Choosing a career path in community health was a great fit for me. It allowed for me to use everything that I learned in school, everything that I learned in residency. It allowed for me to work in a practice that was modern, that really was patient-focused, and I got to work on a great team.
It allowed me to practice dentistry in a manner that I didn't think I would be able to. I spend more of my time on the person. So the person comes into the operatory and I'm looking at everything. I'm looking at the way that they're walking, I'm looking at the way that they're holding their hands, I'm looking at their facial expressions, because I'm essentially having to assess this patient to figure out how I'm going to meet them, how I'm going to engage them. I always get down on the level of the patient. I always ask them, tell me what we're working with. Tell me what it is that you need me to know about your teeth. Tell me how you got here. Like, tell me the whole thing.
The quality of care a patient receives when they visit a community health center, I think, is exceptional. Often, from a provider perspective, working in the community health center, you're able to engage your patients in a way where cost is not the primary concern. You're allowed to work as part of a team. You're allowed to collaborate with other professionals, really find out what the patient needs, what is it going to take to make them healthy. When you approach patient care in that way, I think the patient care becomes better. Patients report that they have a great experience. Often we exceed their expectations. I'm not really sure what they're expecting when they visit with a community health center, but to visit in a community health center, I know that we're doing great work and we're often exceeding the patient's expectations.
It's been the best place for me to be able to utilize my skills and to help a community. And it was always, I think you identified this earlier in our career, that if we were going to raise our kids in the community, we wanted to be able to have a positive impact on the community.
The difference that I make, I hope, is every day. Every day coming in with a positive attitude, showing people how to do things well, efficiently, thinking about the details, being a role model for my colleagues, also hopefully trying to inspire my patients. I think my journey in my profession, my path to a community health center, probably has a lot to do with my desire to have a work-life balance that worked for me. I'm able to work in an environment that people understand who I am, all that I have to offer. One of the things that surprisingly happens frequently is I'll meet a family and not realize that I may be the dental provider for a member of that family. I'm like, oh, we've heard such great things about you. When that happens and I'm with my kids, I'm very proud of that interaction, because it is one of my goals to be a positive role model for them. So that is something that kind of connects the dots for me, the impact that I have in the community, how that impacts my own family.
Being able to interact with someone, and I think about the patients that are super hesitant to come into the dentist, and by the third appointment, they're talking to me like I'm their aunt, their cousin, or their friend. That is like the best feeling in the world, because you've jumped all the hurdles that prevent them from engaging in care. That is the best feeling in the world, because I'm supposed to be one of their people that help them stay healthy. So that's it for me.
Discover career opportunities that will kindle or rekindle your professional passion and purpose. Check out job listings on the Pennsylvania Primary Care Career Center website, www.paprimarycarecareers.org, or call 717-761-6443.